2013 Lasker Bloomberg Public Service Award for leading a historic transformation in the way we view the globe's most pressing health concerns and improving the lives of millions of the world's most vulnerable. Honors Bill Gates and Melinda Gates.
Bill and Melinda didn't invent the term global health, but they might as well have. They've given it a concreteness and a visibility that it otherwise would never have had.
Well, we believe that lives lived anywhere in the world all have equal value, and yet the world doesn't treat all lives as if they have equal value. We want to make sure that innovations that we have in the West come to people all over the world so that they can lift themselves up, and so those lives all can be treated as equal.
It was pretty stunning to us to find out how many children were dying in poorer countries and how little was going in to help out with that. And so we saw that with our background in innovation and business, that would become a primary cause for us. That became our primary goal.
And so we really said, gosh, is there something private philanthropy in partnership with others can do? And we found that to be true over the years. And that something could be done about that if you put the right research and development in with partners against those childhood diseases.
They're doing things that are not easy. If they were easy, they would have been done a long time ago. But they're important.
I think if you want to sum up what the Gateses have done, it is partially making people aware of public health issues and that there are ways to attack those issues, and if we band together, we really can make a difference.
One of the innovative things that Bill and Melinda have done is to challenge scientists around the world to find solutions to the health problems that afflict the most needy.
So that's partly why we're optimistic, is that science in general is doing good work. There's more attention to the problems of the poorest. And then there's funding now to really take those ideas and turn them into practical products.
The issues that we're trying to tackle for the world are issues that have been left behind because they are very difficult issues. And it takes the greatest scientists, the greatest people in delivery, the greatest minds to work around these problems to really make change.
There are still 4 million babies that die in that first 30 days.
By shining light on these problems, convening actors of different types, creating new kinds of partnerships, whether it's Gavi or Global Fund or product development partnerships, we think the pace of progress is dramatically higher today than it was a decade ago.
They can talk to world leaders, and they've achieved some great successes in getting the cooperation of governments, including financially.
In many senses, it's really not about Bill and Melinda Gates and the Gates Foundation doing something. It's Bill and Melinda Gates and the Gates Foundation facilitating other people to come along and make a difference in this world.
One example would be vaccines. They put together an innovative public-private partnership, Gavi, the Global Alliance for Vaccines and Immunizations, and on the other hand, they created a new mechanism for taking expensive vaccines that were on the horizon and bringing them to market at lower cost to low-income countries much more rapidly than they ever had in the past.
Well, vaccines are the miracle technology. They are one of the lowest cost ways to save a child's life. For a basic set of vaccines, it doesn't cost very much money, and it's what's allowed childhood deaths around the world to decline so much.
They explain almost half of all these improvements that have taken place, and there's more to come. We need a malaria vaccine, an AIDS vaccine, a TB vaccine, and brilliant people are hard at work on those problems.
With polio, it's been elusive to get the final few countries wiped out, but Bill and Melinda are determined to do it.
We're big believers in polio eradication. We're putting a lot of our resources in and encouraged other philanthropists and governments to come in. We're working with some great partners, and we're going to make sure it gets done.
The other innovations that we see for sure for women are in family planning. So having new contraceptive tools in places like Africa, women primarily prefer to get an injection, and we can put it in a smaller form of a shot where a healthcare worker could take it out to the woman in her village. That would make a transformative difference for women being able to use a family planning tool that they want to use in the way that they want to use it.
What I've always appreciated is that the Gates take a look at how to deliver the service, how to train the people that have to do it, how to deal with unreliable transportation systems and no communications.
Well, Bill and I call ourselves impatient optimists. That is, we are impatient for the things that have come in the wealthy world to come to the rest of the world, but we also have optimism in what can be done.
Now, some of the solutions are actually really very simple.
We take a business approach to our philanthropy. We try to look at it from how else could that be tackled? What other partner could do it more efficiently? What other way could it be streamlined in a way that it will have impact ultimately at the end of the day for saving more lives?
Business type thinking is very helpful here to see why business isn't solving the problem and how do we fill that gap.
Do they run things as a business in terms of putting a structure in place and managing results and allocating resources and making decisions and giving people respect and treating them like customers, if you will? Yeah, sure they do it. If you say it's done where the profit motive is the only thing, which in capitalism basically it is, then no, they don't do that. The satisfaction, the dividend or the earnings that the Gateses get is in satisfaction of knowing they did something that changed the world.
Dramatic reductions in childhood death, dramatic reductions in malnutrition, those are two of the things we think are necessary.
I would say that these are problems that many of which can be solved in our lifetime. If looked at in the right way with the right set of partnerships and helping build up country plans that make sense for a country, we can tackle these childhood deaths.
They're not things you do in a day or a week or a month, and they're not easy things, and in some cases you fail. But if you succeed in some big ones, it will change the world, and that the story will be written for really probably centuries to come.
The two most important words I want to share are thank you. Bill and Melinda Gates are visionaries and doers. They have been instrumental in helping us make significant progress. They are vital partners of the United Nations.
I think it's fair to say that their work has touched the lives of literally hundreds of millions of people around the world and set the blueprint for how we're going to continue to move forward in the decades to come.